Everyone. On behalf of the Kentucky and American Heart Association, I want to thank you for joining us today to our first Mission and Community Impact Dialogue. I'm Tracy Monks. I'm the Community Impact Director for the American Heart Association, and it's my pleasure to welcome you to this important discussion on how the American Heart Association is responding to the COVID-19 pandemic while continuing its core mission to fight cardiovascular disease. Without a doubt, work of the American Heart Association is more critical than ever before, as heart and stroke survivors are among the most vulnerable population. We have an impressive group of panelists that joined us today who will highlight this great work, and it's our hope that you'll come away feeling proud to support an organization that's truly making a difference in very challenging times. And now I'd like to welcome Wave 3's own Shannon Koban, who'll be our moderator for today's conversation. Shannon?
Thank you so much, Tracy, and thanks to all of you for joining us. And hopefully you were able to get on Zoom because we had some scary moments trying to get this going. I am not a Zoom expert. I have learned that very quickly. But thank goodness we are meeting right now and talking about this, because this is such an important issue for those living with cardiovascular disease right now amid the ever-changing pandemic and all of the numbers that we're hearing, and we know you have a lot of questions. So we're going to talk about the American Heart Association and also how Metro Louisville is responding to COVID-19, and also the resources that are available that you can get some help. So as we begin our conversation, there is a chat option. So that is at the very bottom of your screen on Zoom. So you just can click on that, and then we'll be able to see some of your questions that you may have. And we will have Q&A toward the end of the session today. But now, let me introduce our panelists who have generously given us some of their time today. First, we have Dr. Jim Frazier. Dr. Frazier is the Vice President of Medical Affairs and Quality, Norton Healthcare. Also, Dr. Mark Slaughter, Professor and Chair, Department of Cardiovascular and Thoracic Surgery, University of Louisville School of Medicine, Executive Medical Director, Jewish Hospital, and Director of Heart Transplant and Mechanical Assist Device Program. Dr. Kim Perry, who is the Senior Vice President and Chief Medical Officer of Kindred Healthcare, and David James, Louisville Metro Council President. So thanks to all of you for being with us. We look forward to hearing all of you. So once again, if you have a question for some of these panelists, just go down to that chat question and write your question, and we will get to it later. But we're going to start off with Dr. Frazier to talk about his perspectives from a medical point of view. So talk about the hospital perspective right now with the number of coronavirus cases, and what is your day-to-day like right now?
All right, thanks, Shannon. As you can tell, Mark and I have not aged a bit since those pictures that you got up there. In all seriousness, talking about the response for the hospitals and the systems, when this thing first started back in the end of January, 1st in February, I think there was a lot of concern just because we didn't know exactly what we were looking for. I think there was a lot of unknowns as far as how the disease process would actually pan out. And then, of course, sort of the worst case scenario, what we saw in Manhattan, just kind of really brought the doom and gloom and a lot of concern and panic from the general public. I think a lot's changed over the last 2 months. I think we know what we're looking for now. From a hospital perspective, we've always been able to provide safe care and deal with infections and infectious processes, multiple resistant bacteria, different types of viruses. We're used to dealing with isolation. But when you didn't know what you were looking for, the testing initially was pretty limited. Initially, you had to go through the CDC. So you literally had to send a sample to Atlanta to get a test. And then within a few weeks, you could go to the state. But still, there was very limited testing, which caused even more concern. That's all changed now. We know what we're looking for from an imaging perspective. We know what we're looking for from a testing perspective. We have the ability to test now. And it's created a much more calm working environment now that we realize what we're doing. I would say things are going well. We are beginning to reopen in accordance to the governor's guidelines. We will be back to 100% capacity starting this Wednesday of elective procedures. We are testing and screening all of our patients prior to procedures that we're going to require anesthesia. as well as any of our inpatients. Fortunately, we continue to find a very low percentage of those patients that are positive. And so really the one message I want to get out to our viewers today is that we are safe. It is safe to go get care in our facilities. Please don't put off signs of stroke or signs of heart attack, chest pain. We are safe. We're here for you. If you feel like you would have sought care otherwise, then please come in. I will make note of just a few changes that are different that folks probably need to understand. One is we've had to limit the number of visitors in the facilities. So we've kind of gone from this open door policy that anybody could have as many visitors as they wanted to now we only allow one visitor during restricted hours during the daytime, unless you're pediatrics and you can have two visitors. Obviously, we work with people that have either special needs or compassionate care. We make exceptions for those folks as well. But we do ask that if you show up, that ideally you bring your own mask. If you do not have a mask, we will provide one for you. We would escort your visitor to your room, and then we would request that they stay in the room until they're ready to leave. And then once they leave the room, that they would leave the facility. We are screening all of our guests for signs and symptoms. That includes temperature checks, looking for fever, as well as questionnaires on signs and symptoms of the disease. On the outpatient side, it's a little different. We're really trying to minimize those waiting rooms. Whenever absolutely necessary to be in a waiting room, we are practicing social distancing, including spots like the cafeteria in the facilities. But really on the outpatient side, we're trying to have our families wait in the car. We would notify you by text or phone call when your room is available, and then you literally walk right in, you get seen, treated, and then right back out to your car. The whole time you would be in a mask, as well as our providers. So I'm going to pause there, and I'm sure we'll have some questions about what else is going on in the facilities.
Dr. Frazier, one question real quick for you. So Governor Beshear has been recommending that everyone in the community go get tested so that they have a snapshot of how many cases there are. Do you agree with that recommendation?
I was not aware of that specific recommendation. I mean, right now, we try to prioritize to where it's the highest risk patients that we've tested first, followed by our employees and our inpatients and our first responders. But now that testing has become more widely available, I know that we've done through the city and the state some drive-through testing, as well as what we've been able to do in partnership with the Louisville Urban League, and we're going to St. Rita's on Wednesday, which is, I guess, tomorrow.
Gotcha. All right. Dr. Slaughter, thank you for joining us today. And you're a cardiologist, and I know that one of the big concerns for COVID-19 is if someone with an underlying condition contracts it, it could be much more serious. This has been a huge concern for me. My son had open heart surgery as a child. So how can people who have underlying conditions, including heart disease, or maybe they suffer stroke, how can they protect themselves right now?
Yeah, and just one slight correction. Actually, I'm a cardiac surgeon. Maybe I'll back into that, because I'd like to start to just re-emphasize a couple things that Dr. Frazier mentioned that I think really is important for the public. And that is that the hospitals are safe. The hospitals here in Louisville, as well as nationally, have done a tremendous job of identifying patients, isolating them, and treating them, but really keeping them separate then from the rest of the patient population. And the number of patients that have actually contracted the disease, and even healthcare workers while in the hospital, is incredibly low. So I think one of the major messages that hopefully will come out of this session today is that it is safe to access the hospital. And the hospital, nurses, doctors, administrators, leaders, they've done a tremendous job. So your question and what you're alluding to, though, is real, and it's been a significant problem. So although this is clearly an issue, there are people that are going to get sick and potentially might die. Still, the #1 cause of death in the United States is going to be cardiovascular disease. And the problem that's arisen is so many patients are afraid of accessing care because of their concern of potentially getting sick or the disease while in the emergency room or while in the hospital or the doctor's office, as Dr. Frazier alluded to. Say there's many patients that have canceled appointments, even just for, sort of follow-up. And there's multiple studies out that have demonstrated that starting around March with the stay-at-home orders in most states, emergency room visits dropped by about 50%. The number of heart attacks actually being picked up by EMS went up, but unfortunately they were fatal in the field and never made it to the hospital. So cardiovascular disease has not gone away. The hospitals are safe, and if they have signs and symptoms, it's so important that they would still access care through the same pathway, whether it's calling EMS, going to the emergency room, or calling your primary care doctor. The idea that, there still is cardiovascular disease. There is some that is maybe, we'll say, sort of non-urgent, but that really needs to be determined by the healthcare team, not by the patient alone at home thinking they're going to wait it out. So I think the most important message is the hospitals are safe. Cardiovascular disease, whether it's heart attacks, strokes, high blood pressure, their diabetes, these are still all ongoing problems that require attention and care.
Right. So don't let fear hold you back from getting the attention you need.
Yeah, absolutely. And understandably, as he was alluding to at first, no one really understood. And we weren't quite sure that we would be able to isolate people, say in the hospital or different care settings. But very quickly it became clear that we could do it. It was safe, that we can safely treat patients with COVID-19 and still treat the rest of the patient population safely without putting them at undue risk.
Gotcha. Okay. Thank you so much, Dr. Slaughter. Dr. Kim Perry is also joining us today. She is with Kindred Healthcare. But talk to us about the American Heart Association and the work that the American Heart Association is doing right now.
So the American Heart Association has been very busy. Currently, we're leveraging our science and our relationships to help lead the conversation by bringing leaders together in cardiovascular disease and stroke care to share best practices and doing webinars regarding COVID-19 across the nation. The American Heart Association is assisting healthcare workers by providing educational resources for ventilator management and cardiac resuscitation for this specific population. The AHA physician volunteers have even developed a COVID-19 cardiovascular disease data registry. And what this does is it shares real-time information from acute care hospitals to better help clinicians and researchers understand and provide feedback on the current treatments that could be available and how to best help COVID-19 patients. We are teaching hospitals and communities how to do hands-only CPR and making sure that we also note that we can still do CPR hands-only with the mask on, and even if you're really concerned, put a loose covering on the victim's mouth and nose. We are working with communities across the country to ensure people with greatest need have access to care, financial resources, even nutrition with our special nutrition assistant program, and any other resources that they might need. We are always working with the federal and local governments on that. Resources are available to help parents and teachers, because we all know we're going crazy right now, try to keep our kids happy, healthy, and active. We are working also with businesses and churches to help their people stay happy and active. And some of the exercise routines and the kick cabin, fever to the curb have been great resources, and I've used them myself. Through social media, webinars, and other alternative ways, we're meeting people where they are and providing them the information that they need
So very important things that we're working with. We have great support network. If you go out to our AHA website, you can get all that information. So we're busy.
Sounds like you are. And so, Dr. Perry, just letting my kids play Fortnite 10 hours a day is not recommended?
Maybe not. I can't say. Maybe they should do a video on how to learn CPR while they're, having some downtime.
That's a great idea, and I think we'll work on that. We know that right now, so many organizations need the financial support. So talk to us a little bit about how the unrestricted gift being made to the American Heart Association, how has that helped during this time?
Sure. The AHA recently gave a grant of $2.5 million to researchers and clinicians to really help find treatment and, of course, the most important thing, a vaccine for COVID-19. We are working together with many organizations to get this done in this most unprecedented timeline. I mean, we're really fast-tracking this research to get a vaccine developed.
How soon do you think that is a real possibility?
Well, hopefully it's as soon as this fall, but I think more realistically, it'll probably be the end of the year or the beginning of 2021.
Wow. Okay, that brings up a lot of questions about what the next few months will look like for all of us, especially as many of us in Kentucky are thinking about the Kentucky Derby in September. Let me introduce right now David James, the Metro Council President, and thank you so much for some of your time today. I know that Louisville has been extremely busy working on diagnosing people and making sure that they're getting the help and that you have the ability to get tested in places because someone may not have access to a vehicle to get there. What else is going on right now in Metro Louisville to help us get back to more of a normal state? David James? I think you have to unmute your mic, maybe.
There we go. Thank you. Can you hear me now? All right.
Yes, I can hear you.
Thank you, Shannon. Thanks for having me. But one of the things that we're doing right now is the mayor's working on something we're calling Build Back Better. So we've taken down the economy, now we have to rebuild it. But when we started going through all this, some glaring problems that we have in our community, in our country, in our city, came shining through, areas that we aren't doing well, that we need to do better. And so we've broken it down into about 7 areas in the economy, health and safety, education and talent development, social infrastructure and impact, built and natural environment, arts and culture, hospitality, sports, and of course, urbanism. So we are looking at how we can bring back Louisville, but bring it back better than it was and be inclusive on the entire city when we do that. And also, when it comes to testing, we need to make sure that we're able to provide testing for everybody that wants testing, and not everybody has transportation to be able to get that testing. And so we're looking at ways to do that. And then our health department is working on doing contact tracing, and that's a vital part of getting our economy going together. So all those things combined are some of the things that Louisville is doing right now.
Some of the numbers that we're hearing about the economic impact of this, it's pretty scary. Can you kind of go over those with those joining us right now? Sure.
For most all cities across the country, the revenue loss due to businesses being closed and employees not working and paying taxes is taking a toll on cities. For Louisville in particular, just this fiscal year, which ends June the 30th, we're looking at about $47 million a deficit just for this year since we started this issue in March. For next year, probably in the tune of $70 million. And so that's a tremendous amount of money. And that's why you see me and the mayor and others talking about in the next stimulus package that Congress puts together to please include cities in this package, because that's how we actually deliver services to people. That's how we pay for sanitation workers and police officers and the librarians and the corrections officers and EMS workers and public health. All those things are how we get that done. And because so many people are not working right now, they're not paying taxes because they're not working because the government asked them not to. And so in order for local governments to provide those services, we have to have some revenue. Otherwise, for Louisville in particular, there's going to be some pretty steep budget cuts that could equate to, maybe 1,000 people losing their jobs. And that means those are police, fire, EMS, public health workers, everybody that we actually need the most right now. And so call your congressman.
Right. And say what specifically when we call?
Call your congressman and say that in the next stimulus package to please include cities so they can have replacement revenue from what they've lost this year. If they don't, then those basic services that we all depend on every day will not be available in the way that you're accustomed to and that you need.
Right. And especially when you talk about crucial services like police and fire. That's so
absolutely. Absolutely.
Well, thank you so much for joining us. So I'm going to open it up to Q&A from those people who are joining us right now. And I have a question here. It's to all of the panelists, and it's a pretty specific one. It's talking about, so I'm not sure if you would be familiar with it, but it's talking about research that Don Miller, John Trent, Paula Bates. So Dr. Perry, you're shaking your head. Yes, you're familiar with this. Okay, so this is a possible COVID-19 vaccine. So how promising is this?
Well, there's many vaccines in development now, and just last week I was talking to Dr. Bates about her work in California. So far, the phase 1 testing is going very well, but it's still too early to predict if we'll have something available by the end of the year that they are working on. It's showing very promising results. They've had few to none side effects from the vaccines that they're working on, and her group particularly. So hopefully, as they fast track it, maybe by the end of December, they will fall on something that will really be the pearl for this pandemic. But there's still a long way to go.
Will this be sort of like a flu shot that we get?
Most likely it will. What we know today is that it may give immunity for 2 years. So it may be something that we have to get every 2 years, right? It's unknown territory that we're charting here. So it's very up in the air, but the plan is hopefully that it will carry immunity for 2 years.
Okay. Would any of our other panelists like to jump in on that question?
Well, I would just, as suggested, there's multiple programs and individuals working on it, which is incredibly important, because it's unlikely that one program or one person's going to hit the home run right off the bat. But it's so important that people still realize that while waiting for the vaccine, that following the guidelines of hand washing, face mask, space distance between is still critical, because at the moment it's the only way we really have to reduce transmission.
So that's a great question. I want to ask you about face masks. So yesterday I went and I got my hair cut. Woo! also got the grays covered, but so they were all wearing face masks. I had a face mask on, but when they were putting the color on, I took it off. But how important is it? Sometimes I go to the grocery store and I see people not wearing face masks. So what do you say about face masks? Our panelists. Anyone who would like to answer?
Well, I can answer that. Face masks are one way to protect us and protect other people from getting this disease. If two people have face masks on, the protection is going to be very high. If only one person's using one and the other one doesn't have it, it's going to increase your risk of spreading this disease. So, it's really, really important. I know it's hot and it's uncomfortable, but wearing your face mask in public is really something that you really need to practice as a new normal.
And if you are invited to someone's home for a barbecue, which is something that would happen frequently during the summer months, you would recommend keeping it on all the time except for when you are eating?
I would at this point, especially if you don't spend, your regular time, if it's not your immediate family that you actually live with, yes, I would recommend that you keep it on as much as possible. Again, you want to stay away from elderly people or people at high risk as well, and wear your face mask if you're going to be around them. I mean, this is so important, and it's so unnatural for people in the United States to wear this, but this is, we don't have good treatment. We don't have a vaccine. We still have to practice and be safe in public eyes.
Yeah, it is such a weird thing. And the other oddity about it is when I'm wearing the face mask, for some reason, I feel like I can't see or hear. I don't know what that has to do with anything. But
I think it's hard to hear people talking with face masks, so you may have to really speak up louder than you're normally used to. I think that might be part of it.
Yeah. All right. Dr. Slaughter, I have a question for you, because you spoke about hospitals and you told us how safe they are right now. People should not put off going to a hospital if they need that treatment. Is EMS meeting the same expectations and guidelines for safety, and is it best to call 911?
Yeah, so they also have very strict guidelines, for wearing masks, gloves, hand washing. And so the idea is that presumably, say they're asymptomatic, getting their temperature taken, and they are not actively infected. So by them wearing protective equipment, meaning masks, gloves, and following protocols, it's extremely unlikely that it would not be safe. And if you need the service, it's always a balance of risk. And the idea is their risk is very, very low. Your risk is high as a patient if you don't access care. So yes, they're following all guidelines. They're doing everything that they could and should do. And that should not be a reason not to access 911, EMS, or the emergency room, even, in those cases.
So is there any thing that we should be doing right now to build up our immunity to help boost an immunity to COVID-19? Any special vitamins or drinks or more sleep or anything like that?
I can help with that. I think, being healthy and being active and eating properly is going to help your immune system. Definitely getting enough sleep, maintain your stress levels as low as possible, or maybe you're like me, I go for a run every day just to relieve my stress and really get some fresh air. I think you really have to do what's best for you to relieve your stress. I think if you're going to take any supplements, I would suggest zinc. I take it myself to boost your immunity. There's some data that shows that works, but I wouldn't hang my hat on that. I would hang my hat on healthy lifestyle.
Okay. Any of our other panelists like to add to that?
Yeah, I would just reinforce that though. I think if you're looking for a silver lining or, through some of this, is that it is very clear more people are outdoors using the parks, exercising, eating better because they're eating at home. So it's less, so all those things are helpful. I don't think you can identify a vitamin or an activity, but collectively the idea is a healthier, lifestyle clearly is good for you. And I think hopefully some of this will be maintained even once this pandemic ends.
And it was good to see that in the city of Louisville on Friday that the nets went back up on the tennis courts and pickleball, and people are allowed again to bring their dogs to the dog park. So all of that does help reduce the stress. Dr. Frazier, someone was asking about telehealth and heart services. We've utilized telehealth quite a bit with my own house. Is Norton Healthcare doing that, telehealth for heart services?
Well, let's talk a little bit about telehealth because that's something that it's been around for some time. It quite honestly has been a little slow to be adopted outside of certain sort of niche service areas. I think there's a lot of barriers to that, which we're trying to knock down and improve the telehealth care. I believe that the convenience for the patients is really going to drive the demand for telehealth. We just announced at the end of last week that we are going to be doing drive-through testing. Right now, we're doing drive-through testing for coronavirus only, but we are going to be working on the drive-through concept where you could go and get tested for other things too, like influenza, potentially strep throat. You get a blood draw, those sorts of types of procedures where we would, the concept would be you would have a televisit, and then if you needed some simple labs or screening diagnostics, you could go there and receive that, and then in conjunction with your televisit, we could try to put things together. I would not recommend telehealth if you're having active heart symptoms as far as chest pain and those sort of things. It really is for the lower acuity symptoms, typical URI, possible, like I said, strep throat, influenza, even those sort of things. If you're just wanting to make sure you don't have strep throat, for example, for your child, then there's a way we can do that safely through telemedicine.
What about getting tested for the antibody? How is that something? I hear a lot of people say, I want to get that test to find out if they've had it.
So we offered that as of last week to all of our employees here, all 16,000 employees. We've had a tremendous response from that. We scheduled thousands of tests so far. I will say that it's a very, very low number of people that we're finding that are positive, and even lower number of people that are positive that did not have a positive PCR test. So I think it's very helpful for you to know that as a snapshot in time to know your positivity. But at the same time, we don't really know what that means from an immunity perspective. We don't know what that means if you can be infected again. This virus is only about 6 months old. And so we're not sure how much these characteristics are going to be typical, of, say, an influenza type virus or something else. So we continue to study and learn more about the virus. I certainly think that if you want to get tested, we offer serology testing, but be cautious that having a positive test will give you some sort of false sense that all of a sudden you're protected and you don't have anything to worry about. And you don't have to practice social distancing and hand hygiene and those sort of things.
And that is a blood draw, correct?
It is.
Yes. Okay. And the other, have all of you or any of you been tested for the coronavirus?
I have not. I've had an antibody test that was negative as well because I do live with 2 healthcare providers that did have corona. So.
Oh, you did?
Yes, my husband and my son are both physicians. My son worked in the ICU with COVID patients and did become positive, although had very little symptomatology with it. And my husband sees post-COVID patients daily in his practice, and did get corona and was very sick for several weeks, but has done a remarkable recovery, thank goodness. So everybody's fine in our family.
Oh, I'm so glad to hear that, Dr. Perry. Can you talk to us a little bit about what is it like for a person who is diagnosed with the coronavirus? Because we hear so many people are asymptomatic, and then you hear the pretty scary stories of people on ventilators and those who do not make it.
There's, it goes from 0 to 100, right? There's people that have very little symptoms and don't even know that they're sick, maybe have a fever for a day. And then there's the ones that are very, very ill, that get really, I think the biggest problem with the people who are really sick is the shortness of breath. They feel like they can't breathe. They feel like they're underwater. They're just extremely short of breath, high fevers. Again, they lose their sense of taste and smell, which is a key symptom of COVID-19. But I think the ones that are very, very sick, it's mostly respiratory, and that's why they seek emergency attention.
So we have this new TID syndrome that we have 4 cases in the state of Kentucky. This is something that is scary to me, scary to a lot of parents, especially when you have a child with the underlying health conditions. What do we know about this right now? And this is open to all of our panelists. And Dr. Perry, do you want to start with that?
Yeah, I can. So I'm an emergency medicine physician by background, so I'm not a pediatrician, but basically it's what we call a Kawasaki's type disease. It's a inflammation or immune response that causes severe inflammation, causes multiple organs to fail working, your lungs, your heart, your kidneys. It causes rash. It's a very multi-system type event that you'll see with your children, and it can be potentially deadly. Luckily, it's been few and far in between, but it's something that you really have to keep an eye on with kids. But it attacks every organ. Mark, I don't know if you wanted to add in.
Yeah, I think that's a great description, and it's I guess augmented is that initially I think everyone thought it was going to be predominantly in elderly or those with other health problems, which certainly that is a higher risk group, but it's becoming apparent that actually any person of any age and health can be stricken. You're less likely if you're young and healthy, but you're not immune. And actually, I have a nephew who has a partner. They're like, they do accounting work or whatever. And so 25 years old, was diagnosed and 4 days later dead.
Oh my
and
goodness.
had no other health problems. So it is going to occur in kids. It's going to occur in teenagers, other young adults. Hopefully it's, not common, but that's why sort of all these other measures are sort of so important. And what Dr. Frazier was alluding to is, I'm aware of the numbers at both U of L and Norton, is that if you're asymptomatic though, and you test everybody, it's only about 1% of the people that are coming back positive. So when you asked earlier about sort of general testing is, if you're asymptomatic, you don't have a temperature, the yield is going to be pretty low. On the other hand, the ability to ultimately, though, test, trace, and isolate those people who have disease will be critical in the future. But I think what we're learning now is, kids are not immune from getting the disease. Teenagers are not immune. And when they get the full-blown spectrum, as she described as sort of this diffuse inflammation, Kawasaki-like disease, there aren't many good treatments other than supportive care and hoping that they just sort of survive that cytokine storm.
So I know that, I'm sorry, go ahead.
I was just going to say, I want to give a plug. A lot of people probably aren't aware, but Norton Healthcare provides the support services for the poison control for the state through our children's hospital. Early on, we worked with the governor to institute a COVID hotline as a part of that number. We've seen just a tremendous response in those calls. They are down significantly now that people are more comfortable with the signs and symptoms. But we recently, as of last week, added another feature where if parents have concerns over this inflammatory illness, they can call and get some questions answered there on whether or not they may need to seek attention.
And I'm sure you've been getting quite a few calls, or do you know what the volume has been?
I know the number on that. I know that overall compared to just the poison control calls, we're, oh gosh, probably tenfold up, somewhere between 5 and 10-fold up on the number of calls that we're getting that are related to COVID as opposed to just poison control in general.
We know that a big part of trying to get a handle of this is the contact tracing. David James, do you know how that is going to work in Louisville, and do you think it's going to be effective?
I think it'll be effective. Right now, we've put out a request for proposal for a contract to do that. We're not going to hire those people directly to work for the city because we don't plan on them being long-term employees. And so I believe all those are due by the end of this week. And so we'll be hiring, I believe, right around 200 people to help with that. And so I believe it'll work. I'm not the expert. The doctors are. But that's what they tell us, and that's what I'm going with.
And I think we have to rely so much on people just being honest and telling the truth because, yesterday when I went to go get my hair cut, I was asked, have I been out of the country or been in contact with anyone? And of course, I'm going to be truthful, but you don't know that everyone will do that. So, you know, when you get this test, and Dr. Perry, since you had it, it looks, I think what prevents a lot of people from going to get it and what prevents parents from wanting to have their children tested is it looks really painful.
As far as the testing for COVID, there's two different things, right? You can get the test that says you're positive or negative, and then you can get the antibody test.
Right.
The positive negative test really wouldn't be worthwhile doing unless you have symptoms. Again, it's going to be a very low yield if you don't have any symptoms. So if you start to have fevers, chills, cough, shortness of breath, that's when you need to get the testing done. The antigen test, the antibody test is different, right? That tells you whether you've had it and whether you have some antibodies or some immunity towards getting it again. Again, we don't know how long that immunity lasts. We don't even know the level of antibodies that we need to have immunity. So that test is still kind of wonky to do in general public right now. To recommend that is probably not the easiest thing to do. I think testing is really important for people who are providing health care to other people who are in elderly daycares and populations where they're actually with vulnerable patients and people, even in the general public. So if you do work with elderly and you start having symptoms, you should be tested because you don't want to be near those people. But antibodies, I think we're still, the judge is still out on that one, and the jury is still deciding how to use the antibody testing to the best of our ability and to provide the best knowledge.
So now that things are starting to reopen again, do you think, and I would be interested in what our other panelists think, do you think before people return to work, especially in some of the areas where people are more confined, should you get tested for the coronavirus before you go back to work?
I think you have to have your screening questions answered. And if those come back and you have been around someone, I think it may be a good idea to get tested. I think temperature screening is the way to go, in addition to the questions, to allow people to come into offices. Again, even at Kindred and our support center in Louisville, we're wearing masks when we're out in the hallways, but if we're in our office and isolated, we can take off the mask. And we are doing a lot more Zoom and WebEx meetings than face-to-face, so we're still doing that. We're not doing a lot of traveling that's unnecessary. So things in the business side of things have changed. Our patterns of getting on a plane and going to California on a dime's notice is not done and practiced anymore. So we still need to be extremely cautious. We don't know what's going to happen in the fall either when people start to get together. So got to be careful.
Dr. Slaughter, what would you say? If people get tested before they return?
As she has suggested, the business component of medicine is going to be very different. And then if you just think of business in general now, I think that most businesses are rethinking what component has to be done at the office versus what could be done from home. Or even, you might come in for an hour or two, because you have to sort of discuss some things, do some things as a group, still with spacing and whatnot, but then the rest of your day might be at home. So I think things still will be very different going forward. I know many law firms are planning on having less than 50% of what used to be done in the office now will all be done remotely from home, and only critical meetings will take place in the office. As far as those people that do have to come in, once again, as if they're asymptomatic, they're honest, they haven't been exposed, they haven't traveled, to sort of routinely test them or get the antibody test is not going to be very helpful. On the other hand, we check everybody's temperature at the start of the day. Frequently, I get my temperature taken at least twice, sometimes 3 times. But that may be one of the earlier indicators. And even then, a low-grade temperature of just over 100, you probably need to go home, and just be checked again before you come back. So I think there's some, relatively easy things you can do. But I think the conduct of business as usual is not going to be business as usual. It's going to be a modified business plan, probably for at least the next 12 months, and appropriately so.
Dr. Frazier, what do you think about that?
We're getting a lot of requests from local businesses to help facilitate testing, either going on site where they are offering testing for our through our drive-through services. I think the important thing to remember there, that's just one snip in time.
Right.
And so you could literally go get tested today and find out you're negative and be exposed on the way home and end up being positive in a day or two. So I think there's some value for sure. But again, without having any symptoms at all, the value is greatly diminished.
David James, I know you've been working with a lot of the local businesses. Has this been a question that they've brought up? Should we have everyone get tested prior to returning?
That's come up quite frequently, and Dr. Moyer, who's our public safety director, has advised exactly what our panelists have been saying to businesses also. It doesn't really help other than for that moment right now. Tomorrow it could be a totally different situation. So to depend on that to determine whether you're going to open your business or not, as opposed to having good practices, would be a better option.
So I have a question, David James. For September 5th, that is when the Kentucky Derby is supposed to be held. How many times have you been asked, do you think it will happen? And can you give us your opinion on that?
This is the third time today, as a matter of fact.
Is it? I thought it'd be more than that.
I would simply say that I would. You're not going to get David James to be on the front page of the paper today saying we're not going to have Derby or anything like that. But what I would say is that we all know what the limitations are for people gathering, and I think decisions will be made soon about that. I don't think Derby will look like what we're used to seeing it look like for the past 140 some odd years. I think we're just in a different place right now, and I think everybody has to get used to that.
Dr. Perry, since your family, you have two family members who tested positive for the coronavirus, I'm sure they've done a lot of research, especially since they're doctors, about the impact to their health long-term after having the coronavirus. Do we know about that yet?
Well, I think, again, it's this COVID-19 is a baby, and we don't know a whole lot about it, but I think there has been some information that we're gathering that does show that there can be some permanent sort of disabilities associated with COVID-19, whether it's cardiac or pulmonary or both, and some other disabilities as well. Both my son is only 30 and my husband is very healthy, and he's a lot older than me, but no, he's not. But, and I think they'll do fine. I don't think they'll have any permanent issues. But with the elderly population, especially the population that we see at Kindred Healthcare, which are the ventilated dependent patients, we're noticing that they are going to need quite a bit of rehab and maybe some ongoing therapies to help with their cardio and pulmonary symptoms. So it's not one and done and you recover. Especially if you're in the more vulnerable population with diabetes, high blood pressure, obesity, there's going to be some permanent issues that we're going to have to deal with. And I think aggressive rehab and seeing your doctor on a regular basis and maintaining your healthy lifestyle is going to help reduce those problems.
I'd be curious to get all of your opinions on when you hear people say, oh, the flu is just as bad. And then you see the video that was out this weekend from the Ozarks. It was everywhere on social media with just hundreds of people jammed together at a pool. What is your initial reaction to that? Dr. Frazier, we'll start with you.
Well, I get that question a lot. Is this like the flu? Is this worse than the flu? And, I think certainly when you look at the mortality rate as a percentage, that this is significantly worse than influenza. What the long-term effects of this are going to be are still unclear to me. Certainly there's a lot more people that have the flu than have coronavirus. But of those people who are infected, the mortality rate is significantly higher for coronavirus, although I think we're going to continue to see those numbers come down as we find more and more people that were positive. Certainly right now, there's still a lot of unknowns.
Dr. Slaughter?
Yeah, I agree. And I think sort of as like bullet points, the idea is that it's very contagious. For those people who get the disease, certainly the mortality is higher than the run-of-the-mill flu. Those people with the bad pulmonary complications who ultimately end up on a ventilator or requiring even more advanced care, what we call ECMO, extracorporeal sort of support. Even with H1N1, if you made it to a center that could put you on ECMO, about 75% of them survived and went home. And in many parts of the country in Europe, it's less than 50% are surviving than even on ECMO. So it's a more aggressive virus, and it's not to be taken lightly. So as you asked to start with, when you see that pool full of people, it's just tragic because clearly they have not gotten the message.
My first reaction is I wonder what the rate is going to be in 2 weeks for COVID-19 in that area. I know a lot of people travel to the Ozarks. I actually live in St. Louis as well as Louisville, so wasn't too proud of my community for that. But you know, it's not open doors yet. We're not there yet. We don't have a vaccine. We still have to wear masks. We still have to wash our hands. We still have to social distance. It's not open playtime now. We still have to take this very seriously. And we'll see what happens in 2 weeks in that area with the contact tracing that they'll do with those people. I'm sure we'll see a rise.
Mm-hmm. David James, is that frustrating for you in your position when you see large groups gathering?
It's very frustrating. I know, we've gone through about 2 months of this now, and it feels like when people do what we saw on television, you're throwing it all out the windows like we did it for nothing.
Yeah.
And, I think people have a mental block about this virus. It's something they can't see. So they have a hard time appreciating the danger of it. And even if they don't appreciate the danger of it for themselves, they need to appreciate the danger of it for everybody else. And if people get overwhelmingly sick, they're going to overwhelm the healthcare system. And then we've got problems like you wouldn't believe. And so I think that's something that everybody has to think of. It's not about me, it's about us. And as long as we think of it that way, I think that we will get through this. But acting in that particular way scares me.
Since this is put on by the American Heart Association, a question for those people who are joining us who do have heart conditions. If someone with a heart condition contracts COVID-19, will they experience more severe symptoms, or do we know that yet?
Who wants to go first? So the answer is we don't know. Certainly as a group, obesity, diabetes, underlying lung disease, people who smoked, emphysema, asthma, clearly seem to be at some higher risk to have the progressive pulmonary symptoms. If you in isolation have heart disease, it's certainly a concern, but I wouldn't say we know right now that you're at a higher risk group. On the other hand, I certainly would follow all the precautions. Because of those people that get the disease who ultimately die, it turns out about 25% of them are actually dying of cardiovascular complications. So you certainly want to follow all the precautions. I would be hesitant to say you're necessarily at higher risk, but I certainly wouldn't put myself in situations that, might lead you to get the disease.
Would you go out to eat at a restaurant?
No, but I'm not sure I'd do it now anyway.
Would you go outside? Would you sit outside to eat at a restaurant?
So there's it was a NPR article that was out the last couple of days done by several experts, and they list 14 sort of scenarios.
I shared that on my Facebook page.
And, you know, eating out and even eating outdoors is still somewhere around medium risk, because a lot of it still depends upon how far apart people are. Are the other people going to wear their mask? You know, where did those, you know, servers, and what did they do the night before? Because quite likely they were the folks who went to the Ozarks over the weekend. So the answer is you just don't know. And so you still have to be careful.
I do want to add, I think it is important to get outside and to have fresh air and sun. And I think if you're, like my parents are in their 80s and they are at high risk, I let them sit outside on their own porch, and you know, we cook a meal and they have it from home. So you don't want to be inside all the time. I know my mother in particular would be just driven crazy if she couldn't get outside on the nice days. So you know, I highly recommend that, just for endorphins and to make you feel happier about your situation. But again, you know, going out socially and sitting on a deck at a restaurant, if you're, you know, in a more vulnerable group, definitely not. I'm not going to do that anytime soon. So I try to, you know, curbside if I feel the need to support Louisville and the downtown district where I live. I do a lot of, you know, ordering online and having it delivered. I think that's the least risk. It's still a risk. It's a calculated risk, but I think sometimes you just need to do that to support your community and just to feel a little bit better with yourself, right. Not so isolated.
Dr. Frazier, are you starting to go back out, getting your hair cut, getting your nails done?
I actually cut my own hair, so that came in. That was
wow.
Throughout this whole thing. So I've been doing that since college, and so that came in handy.
And for David James as well.
That's right.
Yes. Yeah. Have you been talking to our restaurants, and how, since they opened on Friday, are they seeing people returning?
They're seeing people returning. Part of their issue for many of our restaurants is they cannot meet their overhead costs with a 33% occupancy rate. So we just passed an ordinance that allows them to utilize sidewalk space, and we're having conversations about closing down different lanes of roadways to expand that even more so they can have space. And so we're trying to help them survive in this time. But I would agree, you know, I think that it's about measured risks and what you're willing to risk to do it. And so I think that everybody should be cautious about that risk that they decide to take, because you're not only taking it for yourself, you're taking it for those around you.
And Dr. Slaughter, that was a really interesting article that you mentioned, and I actually shared that on my Facebook page, and it gives you a lot of great information, as we got a lot of terrific information today from our panelists. So thank you so much to Dr. Jim Frazier, Dr. Mark Slaughter, Dr. Kim Perry, and David James. We so appreciate your time and offering us valuable information during this unprecedented time. And right now, I'm going to turn it back over to Tracy Monks.
Thank you, Shannon, and thank you, David, along with Dr. Frazier, Dr. Slaughter, Dr. Perry. I think it was some wonderful information, and thank you for all your support for the American Heart Association and our community. Such wonderful things that you guys are doing. I'd also like to thank all our attendees for joining us today, and some wonderful questions, and I think we got a lot of great information. Lastly, we want to thank all our local heroes, those that are putting their lives on the line to heal our community, to keep us safe. Our nurses, our healthcare workers, the first responders, grocery stores. I think the list could go on and on. We see them working tirelessly through all of this. So thank you from the bottom of our hearts. And thank you, everyone, and stay safe.
Thank you.
Thank you.